Vision Australia.
Blindness,
low vision,
Opportunity.
So Karen, we talk a lot about how we want kids to be doing what their peers are doing, and but there's some things kind of above and beyond what their peers are learning to do, and parents need to be ready to support them in learning how to do those things. Can you just describe a little bit what those things are that are, the strategies or equipment and things that they need to be able to use above and beyond what their peers are doing?
You'll hear lots of different terminology in this area. You'll hear people talking about disability-specific skills or alternative techniques. You'll also hear service providers talking about something called the expanded core curriculum. These alternative skills or alternative techniques are the skills that individuals learn because they have to do things without vision or with impaired vision. They are alternatives to using vision as your primary modality for learning and applying what you've learned in life. I always think in this area about some of the very specific skills that your child is going to have to learn, like organizational skills, learning how to keep up with his things or her things, not just at home, but when they come away from home and go into the community, go to school, participate in activities outside the home, outside of school, extracurricular activities, where they've got to keep up with their stuff. All of that kind of information is critical for your child, just like it is for every other child, only your child's not going to be able to rely on vision to find things. And I know that as parents and as siblings, you're thinking, oh, there's enough we got to deal with. We can't deal with all this organizational stuff. I'll just organize his bag for him. Give him some folders or give him some envelopes and say, this is what goes there and this is what goes there. No. What I need you to do is show your child the kinds of systems that you use. Ask your child what of those systems might work for him or for her. I'm encouraging you to think about systems that will work right across the different domains in life. Think about how you organize your pantry. How is your house organized? How are your things organized? Share those systems with your child. And then think in terms of, what does my child have responsibility for that he or she needs to organize? It's all about organization in the beginning. How your child is going to organize the stuff that's important to him or her, how your child is going to organize the living space, something that makes sense to the child. Organizational skills are huge for kids who are blind or have low vision because they can't just scan the environment. Systems need to be in place for organizational skills. That's number one. I think number two may be, for all of you, the home and how things are within the home managed. So who's making the beds, who's doing the dishes, who's doing the laundry, who's sweeping up, who's setting the table. These are home management skills. Your child is going to need to learn techniques for doing these skills that are different than the skills you teach your sighted child. So I think this whole notion of how people organize their homes and the specific tasks that they're doing within their homes is really, really important to share with children. Besides that home management section, there's a whole nother set of skills that we're teaching under independent living or activities of daily living called personal management. Personal grooming, personal hygiene, helping kids learn how to brush their teeth, how to wash their face, how to put on their clothes, take off their clothes. These are the kinds of skills we're working on from the early stages of life right through to school. And with blind and visually impaired kids, It's the same skills, but with a different technique. And then let service providers and others help you understand how to interpret those skills for a child with no vision or limited vision. So organizational skills first, independent living skills, and then the next big area, disability-specific skills, are the skills that your child is going to use to access information. And you may be thinking, well, isn't that the responsibility of the schools? Well, the schools are going to do a lot to help your child learn alternative techniques for accessing information. They're going to teach your child either Braille or use of optical devices, teach your child how to use assistive technology or to work with mainstream technology. The schools are going to introduce those skills, but you as a family member have a huge role in terms of making sure that your child applies what he or she has learned at school in that home environment. Do you ask your child to read the menu at the restaurant, or do you automatically take that restaurant menu and read it to your child? Do they use their cane when they go to the shopping mall with you? Do they use their telescope to read the names of the stores when you go to the mall? Or do they simply rely on you? And then the next area within that section, in truth, is what I think of as mobility skills, or orientation and mobility, you may hear it called. As a sighted person, you travel using eyesight. We simply travel through space using eyesight. So children who are blind or have low vision have to learn alternative techniques for traveling through space using sight. They have to learn to use a long cane or use a telescope to read the signage when they're at the mall. They have to learn to use sighted guide, for example, or a human guide in an unknown environment so that they can get through the environment and not run into people or run into things. These are skills that enable a person who's blind or has low vision to be competent in moving through space, finding their way. They may need to use GPS on their phones, but with voiceover or a different kind of auditory output so that they can read the maps auditorily that you and I might be reading visually.
As far as the alternate ways of doing things, I think that's where parents always feel like they're out of their depth, right? And how do they learn how to do things in a way that they never ever thought they would have to do? Was there anything else that parents can be doing so they can just feel more comfortable in that role?
Yeah, I think it's a really good point, Laura. I think I'm asking parents to take on a responsibility that may feel somewhat overwhelming to them at times, because these alternative techniques are just that. They're alternatives to using vision, and most of these are parents who have vision. And so they're thinking to themselves, well, I don't know how to do that. I do think that's where service providers can really help you out. These people know about tools and devices and techniques that people without vision or with low vision can rely on to help them with these everyday kinds of tasks. There are some really wonderful resources that we can share with parents and family members for learning Braille as a family member, for learning techniques in the kitchen, learning techniques in terms of travel, learning how to properly use sighted guide with your student or your child, for example. These are skills that service providers want to share with you, want to teach you how to do, so that you can then use those skills at home. But I don't think that the expectation is that you'll know how to do this from day one, because these are different kinds of skills. If you're concerned at all that you don't have the skills that you believe you need to teach organizational skills or home and personal management skills or access to information or mobility skills, go to the professionals who work with your student, your child, and ask them to help you with that child's learning. I can show parents how to do these things, but then I have to let it go and let the parents take that knowledge and apply it at home. And that's what I'm asking of parents, is that you find out what the alternatives are to doing things without sight.
So how early would those be things that you would be starting from day one, or are you going to let them try some of these skills first without giving them the alternative techniques, or would that be something that you have in your mind right at the beginning?
You're going to need to learn right from the beginning of your child's life some of these alternative techniques so that you can train your child. The home and personal management skills, the organizational skills, those two areas in particular, you're in the perfect place. There's no reason why your child can't pick up his toys, why she can't pick up her towel, learn how to put her towel over the rack in the bathroom. These are skills that you can teach your child just like you would teach your child if your child had sight. Too often parents think everything's a mystery when it's not a mystery. There are all kinds of ways you can do these things. Think what's going to work for you. Do the research, talk to these early interventionists. They'll have people working with them who understand the early developmental process. And you need to work with those folks and learn the techniques that they're teaching so that you can do that at home as well. The earlier you intervene, the better. So if your children come into school having learned how to do these basic skills, manage things at home, keep up with their stuff at home, identify their things from other people's things, they're going to be in a better place than some of the kids that are coming in with full vision who haven't learned these organizational skills and independent living skills. These are important things for your child to do. Whatever those sighted kids are doing developmentally, you want some comparable kind of activity happening with that child without vision or with impaired vision. It's important so that they are developing in the same way that those other kids are developing. Some of those early concepts, really, if you're talking about pre-Braille or you're talking about pre-mobility skills or pre-reading skills, a lot of it's just basic concepts. What is up, what is down, what is left, what is right, what is rough, what is smooth, the shapes that we use with children to teach them how to put puzzles together. All of that has relevance to the next step of learning. So it's all sequential, and I think that we really do need to intervene early and intervene often in the lives of young people who are blind or have low vision. Earlier is better, and more is better with a lot of these kinds of kids because they're not going to be exposed if we don't bring the world to them. Right. They're not going to be exposed to those concepts if we don't label them.
I think that's so important. I think because we don't necessarily have to think about how we learn about those concepts as a person with sight. And it has to be much more deliberate with the kids that we're working with.
Yeah, labels. I think it's about articulating what we're doing and labeling things in many instances. And parents are in the perfect place to do some of that.
I really love talking about skills and about starting early. We're always talking about what's the next environment, and I'm often talking with families and with children, with young people, well, okay, what's that next environment? But that ultimate next environment of leaving high school and going into university or going into a workplace, there's going to be an expectation that you have competence across all of these different areas. But if you don't start learning to catch public transport until the first day of going to uni or the first day of trying to get to a workplace, then it's not going to work for you. That's something that you do need to practice for longer than just that one off. These skills just don't appear if you've only done them once. Right. So I think that message of starting early, doing it a lot, and then continuing to do it. I mean, if you can come into an interview or a workplace with all of those skills, it's going to be a lot easier to keep that job and make friends in a workplace if you have competence.
It's really important that we all remember that we have to take time to look at what kids without disabilities are doing. What are the other kids his age doing? What are the other kids her age wearing? What competencies are out there that the other kids with good vision have acquired? And does my child or my grandchild or my sister or my brother, does this child have the same competencies? I mean, when you were talking about the kid who gets to the first day at uni, if you're the family member that we're talking to right this moment, have you been paying attention to what's going on with those other young people preparing to go to university? Or were you thinking that you would always be the one to take him or take her? And if that's the case, is that going to work for the next environment work? It's always about connecting the dots and making sure that those dots connect from the beginning of life, moving gradually through school system into work or into adult life, adult responsibilities, meaningful participation in life. Define what it is and then think about, are you acquiring the skills that you need? And I think for families, it is really, really important that you remember your child has got to learn the skills that the other kids are acquiring at the same time whenever possible and at the same rate whenever possible, but using alternatives to vision.
So, Karen, I know something that comes up when I'm talking to some parents is, and maybe even sometimes we don't even get a chance to talk about it, but I can see emotionally how it's affecting families, is like, how do they cope with these really overt signs that their child has vision loss, especially even at ages, in the early ages when they don't know how much their vision is going to be affected, right? But we're trying to show them that there's opportunities like using a cane or using a magnifier. Like, how do you help parents cope with that?
I think, Laura, that it's really about families recognizing that these are tools. The long cane is a tool, a handheld magnifier or a telescope, those are tools. The use of large print is a tool. Families need to understand very few people can go through life without ever using a tool. It just doesn't work that way. We use tools for all different kinds of things. Or the child says, I'm not using that magnifier in public. It's going to make me look weird, or it's going to make me look different, or the parent says, no, I don't want you taking out that cane. You have to understand you're depriving that child of a tool that will enable him or her to appear competent in either movement or in activity, where without the tool he or she may look very awkward or uneasy. It's a tool. It's not a stigma. A lot of people say, well, it's the stigma of blindness. There's no stigma to blindness. But if you really start peeling it away and getting to the what's problematic in terms of blindness or low vision, it's really that notion of people being incompetent or unable to do something. So if I look at a person walking through space, comfortably, casually, walking along with a long cane, I don't think, oh, horrors, this person is not going to be okay. This person's blind, oh, poor pitiful person. I don't think that at all. I look out there, I see a person moving through space. Sometimes it doesn't even encode that the person is quote unquote blind. It just encodes that the person is moving comfortably through space. If I look out there as a sighted person and I see someone stumbling off the curb, or if I see someone walk into a plate glass window or door, I think, whoa, what's wrong with that person? It's not using a cane that's problematic, because if you don't use the cane and you trip off the curb, you look awkward, you don't look competent. It's the not looking competent that is stigmatizing, that makes people think, oh, there's something wrong with this person. What I see happening with young people a lot of times is that they'll stop using their tools in high school, That's the place where I see it fall apart for the most part. And they have lots of people that they can rely on. The teacher will read to them, their aides in school will read to them, the other students will read. They get away with it, kind of, sort of. They don't get away with it from the perspective of other people, but they feel as if they're sliding through, because that's what they're doing. They're sliding through when they could have excelled, but no, they don't want to use their tools. And then what happens is they get to university and all the tools come back out because suddenly they don't have all these people to help shore things up for them. Families, if you accept the fact that your child needs a tool to be competent, then that child is going to be competent and use the tools. If you don't accept the tool, then the child is going to feel that they are somehow not able. There's nothing wrong with not having good vision. There's everything wrong with not having good vision and not knowing how to use these alternative techniques, these tools. That's what gets people into trouble, is not knowing how to use the tools. Parents, I hate to say it, but you're the one who's going to make or break your kids in those early years in regard to whether or not they're going to use the tools. If they don't use those tools, they will be in jeopardy moving into the next environment because they won't have the competencies that they need to be successful in life.
And if it is a really emotional time for a parent, I think part of it is dealing with some of those feelings and things that you have, but also acknowledging that, you know, that's part of that grieving cycle and really understanding what you need to go through in order to be a good support for your child.
Right, and I think if parents, if any family member is feeling overwhelmed or discouraged or heartbroken or grieving, it's important to reach out to someone who can help you with that, who can work with you, a counselor, a service provider who's willing to sit with you and help you process those feelings, how you're feeling, what the impact is going to be on your life and on your child's life. So I really think it's important, if you are a family member watching this video, that you recognize that you have a process that you're going through just like your child has a process that he or she is going through, and that's an adjustment to disability process. And it may be that you feel overwhelmed sometimes, or deeply saddened, or angry, or frustrated. That's normal. That's very normal. Find someone with whom you can talk, who will listen to you and help you sort through some of those issues, because it is important that you feel okay, that you feel comfortable with your child's disability, so that in turn your child can feel comfortable with disability and his or her life moving forward. You don't want to leave your child feeling as if he or she has somehow done you a disservice or upset you or burdened you with, because these kids are a joy. Give yourself permission to get some help so that you can feel okay again and support your child.
Vision Australia.
Blindness,
Low vision.
Opportunity.